I'm proud to say that in Texas we have 1,366 Texans who have recovered from COVID-19. But get this, of all these other states in the United States that have far more infectious rate and far more people who have tested positive for COVID-19, Texas ranks second most in the United States of America for the most people who have recovered from COVID-19. Now, one thing that we want to do today is to show you a little bit more graphically about what the spread of the coronavirus looks like both statewide, but also in the largest metropolitan areas. This is the statewide information. I'm going to show you four very important lines. The top line is a blue line, and that is the total number of cases in the state of Texas that's done in a way that is added to every single day. My point is this, and that is, as you see that blue line, the way that it's measured is it's never going to go down because you're adding to it every single day. So when we talk about bending the curve, we'll talk about that momentarily. Just know that that top line, because it will continue to aggregate more and more cases every day, it will never turn. But the key thing to look at on that blue line is what is the degree of the angle? Is it more facing up or is it more laying down? The degree of that angle shows you the extent to which we are slowing the spread. As you can see early on in the latter part of March, the angle was going almost vertically straight up. As you can see now, the angle is laying down more. That means that we are beginning to slow the growth of the coronavirus. We've not yet reached the peak and begun on the decline yet. The red line that you see in the middle, that red line shows the total number of new positive cases on a daily basis. Obviously, it's jagged, and obviously you can see that as we began testing in the latter part of March, there was a dramatic jump, and then it has begun to level off a little bit. But you can still see there is a slight upward slope in the red line, showing that we still have an increase in the number of people who are being tested positive, and we have not yet begun to go on the downslope side of that curve. On this graph, you'll see a green, you might want to call it teal color line. It's right above that red line. It may be hard to see, but it may be the most important line on here as far as I'm concerned. That green color line, it begins about April the 1st, and it's the number of hospitalizations. If you look at that green line, you will see several times when it goes up in number. You will also see what I think is most important, and that is on the right-hand side of that green line, you see that it's relatively flat. So for several days now, in the entire state of Texas, the total number of Texans hospitalized has remained relatively flat, despite the fact that we have more people testing positive every single day. That means that the people who are testing positive are less likely to need to go into a hospital, and that means that their cases are more likely to be resolved without any type of adverse effects. The bottom line is in orange. That's the total number of fatalities that have been suffered. Now, as you see, that line continues to go up also, and is not showing any sense of leveling off right now. Understand this, and that is the fatality numbers always lag a week or two behind the total numbers that come in for those who test positive. And so we will see a peaking and then a downslipping of the total number of people testing positive before we will see a peaking and a downturn in the total people who lose their lives because of COVID-19 if our graphs are consistent with most of the other graphs that we see. Travis County shows the type of line that you want to see. Again, early on, kind of a steep angle, but look from, it looks like about March the 24th, when they had 57 people on the red line, 57 people tested positive that day. From that day on, look at the slope of the blue line. The slope begins to be at a lower degree angle, which means things are leveling off. And you kind of see that with regard to the red line numbers. They did come down in the latter days of March and then spiked back up to 61 and 79 in the early days of April. But since then, their high water mark is 52 and now 43. Again, it's way too early to make any great pronouncements that Travis County is on the downslope. But since about April the 2nd, it looks like their numbers of people testing positive is definitely going in the right direction. So this is important right here. This is exactly what Dr. Zerwas was talking about at our last conference when he talked about doubling times. This is a mathematical sign of success. That line going down is so important. That line going down means that we're slowing the pace at which COVID-19 is growing in the state of Texas. We want to see that line continue to go down in the coming weeks, which will be a further signal that we have bent the curve.